Now, the latest COVID-19 numbers show an increase of 1,600 new cases. There's a concern by the Gauteng government that we will see an increase in new cases after the long Easter weekend as families gather to celebrate the holiday. For more on this, we're joined by the spokesperson of Gauteng, Premier Vuyo Maga. Thank you very much for your time this morning, Vuyo. I mean, just as we were beginning to relax in terms of the number of infections that we are seeing, the deaths and people that are getting gravely ill, this concern has now sparked up in the province. Talk us through these concerns.
Well, good morning, Rifu, as well as your viewers. Naturally, I mean, if you have to speak about the Easter holidays, it's where people really gather as families. It's where people obviously congregate in churches. And obviously, there will always be a concern because the virus over a period of time spreads through persons when people actually do move. So we always give a caution to, in particular, to the residents of Gauteng who ordinarily will then travel to their respective provinces where they were born or where they will actually take a holiday. And we always try to tell them that they must remain cautious and continue to wear the mask because the virus is not gone. And obviously, we are trying to rebuild the economy, but we must never let our guards down to think that the virus is gone.
On the ground, Vuyo, what are you actually seeing in terms of COVID-19 numbers in the province currently before we see this anticipated spike as people return to their various places of dwelling?
Well, they are not as much as it would have been in the previous times. We still have a bit of a worry in Gauteng North. That will be a Sentin, Alex side, as well as Tshwane South. That is your Atteridgeville, Centurion. We still have a bit of issues there, but generally we are not in the worst of situation as it would have been previously. That's why we'll always try to urge the residents of Gauteng to make sure that they keep their guards up and they actually continue to mask. And I must actually say, I was at church on Friday in one of the Methodist church in Victoria, and actually the COVID-19 protocols were extremely adhered to, and I was actually pleasantly surprised. And hopefully that is like that throughout the festive.
No, absolutely. What about our healthcare facilities? I think there's been a great amount of a certain level of relaxation, given that the variant that is currently circulating is not as dire as what we saw in the first 3 waves. How are our hospitals prepared to handle, should we see a little bit of an uptick, our healthcare practitioners as well as resources?
Well, you'll know that over a period of time in Gauteng, we have tried to increase the capacity of permanent beds. Speaking to you now, I think of the 14th of April, we're just over 1,000 cases admitted. That will be both in the private hospital as well as in the public hospital. So we are still managing to cope. And obviously, we don't want the matter to go over edge, where we're going to put an unnecessary strain to the system. But I must actually say the system is actually doing fine.
The vaccination drive in Gauteng, I mean, there was a lot of a ramp up at the beginning of the vaccination drive in the country, and one would feel like it's come down somewhat in that this notion that we should be getting vaccinated is not being driven as hard as it was initially. So how are we doing as a province in terms of making sure that residents are getting vaccinated?
Well, we actually go where people are congregating. Yesterday, the Premier was at the Rand Easter Show. We were told there are over 150 people who went to the Rand Easter Show actually were vaccinated. Even Premier himself yesterday, he took his booster shot at the Rand Easter Show. We've been speaking to the sporting association, like the PSL, try to drive the message to those fans who are going back, to the stadium, that they must make sure that they get the vaccination. We continue to partner with the private sector, what we'll call job at work, to make sure that if you've got employees that you want them to be vaccinated, we can always bring our guys there. So the pop-up sites are continuing, but naturally, we believe that the focus of South Africans will obviously shift to their livelihoods and to make sure that they start to rebuild the economy, they start to rebuild their lives. But that does not necessarily mean that we have actually relaxed. Maybe it's just a focus of maybe yourselves, naturally to focus on other important issues that are affecting South Africans.
And just a final thought from you, another important issue, Vuyo, is that we are approaching the winter months. So these observations that you and I have just been discussing are going to be extremely crucial in the coming weeks.
Yeah, no, indeed. I mean, like the winter month is always very problematic because obviously the weather changes and all that. But I think over a period of time, we have kind of learned, and it becomes almost embedded in our system, that whenever we go to congregated spaces, we must actually wear our mask. And we must never really take it as a favor to government. It's actually saving our own lives. As I'm saying, I'm a bit fluish. I'm literally staying with my mask on, even in my house, to make sure that I don't even affect other people, not only on COVID alone, but generally on the sickness. So it's a system that it must be within us, that every time we are not feeling well, every time we're actually meeting with other people, let's protect them and also let's protect ourselves. And South Africans, I think they have actually done that quite well, and we continue to request them to do that.
No, absolutely, Mr. Vuyomaga. Thank you very much for joining us this morning. I'll leave you to go and nurse those flu symptoms of yours, and hopefully you'll experience a speedy recovery. Spokesperson there in the office of the Premier.